We have a great reminder of why an annual comprehensive eye exam is just so important to your overall health. As part of our month-long dry eye series, we sent Nicole DaCosta out to South Waterfront Eye Care to learn what dry eye is, and be sure to scan the QR code on your screen to schedule your next appointment.
As part of our Dry Eye series running the month of July, we're learning more about the importance of scheduling our annual eye exams. I'm joined by Dr. Mila Yusifova at South Waterfront Eye Care so we can learn more from what she's seeing. Thanks for having me out today.
Thank you.
Well, I came to the right space today to learn about dry eye here in the Portland metro area. This is your specialty. So let's tell folks at home, what exactly is dry eye?
So there are a lot of different things that happen on the eyes that can be lumped under dry eye. It could be inflammation of the eye, it could be ocular rosacea that causes dry eye. So dry eye is very common. In fact, it's one of the most common reasons why patients see their eye doctors. And it's been estimated that over 50 million Americans suffer from symptoms of dry eye disease.
And how we get diagnosed, that's where that comprehensive annual eye exam comes in. So when folks come to you, what symptoms are they having?
The common symptoms would be gritty, sandy, kind of like you have something in your eye. You can have burning, and you can have itchy eyes. So some patients will think that they have allergies, and they will treat it improperly with allergy medications, which in fact can cause more dry eye. Or you can have symptoms that are not necessarily what you would think that are dry eye related, like fluctuating or blurry vision. So they'll come in thinking that they need a stronger prescription for glasses or contact lenses, but then I do see that they have dry eye, which is the contributing factor to their visual disturbances.
Right, and what are some of the lifestyle choices that all of us make each day that might contribute to dry eye? I'm thinking of screen time for one.
Yes, you are right. How much time we spend in front of screens, how our eyes are blinking or how little they're blinking and how incomplete they're blinking in front of the screens. Other things, stress, diet, poor sleep, so there are modifiable factors, but screen, unfortunately, we are all spending way too much time, whether it's on our computers, our phones, and which is why we're seeing dry eye in the younger population now too. So we've been doing dry eye for 10 years, and what I've learned is that there's not a magic treatment that works for every single patient. So we have different treatment options for different patients. We also do in-office blood draws and make a product. We make eye drops from patients' own blood. PRP eye drops, platelet-rich plasma, you've probably heard about that for hair treatments or facial treatments.
Yes.
But we can do eye drops from PRP as well.
Now tell me, you recently expanded and we're going to go check out the new space, so congratulations. Let's go take a look around.
Yeah, let's do it.
So great, just steps away from your office, this beautiful new space, and in here is where we can do those in-office treatment options. So tell us about some of those options.
Here we have one of the machines. This is our second IPL, Intense Pulse Light, which is an FDA approved treatment for dry eye because of ocular rosacea, which is one of the leading causes of meibomian gland dysfunction, which is what causes dry eye. The other treatment that we have here is TriLift, which is a dynamic muscle stimulator. We lose eyelid elasticity to our lids, to our skin as we get older. And that's one of the reasons that our blink quality can be compromised. This is specifically targeting the muscles around the eyes that help with the blink quality. So we can help to kind of bring back the elasticity and the quality of the blink with this treatment.
This is something that's strengthening that collagen production on its own?
Yes. So it has radio frequency, it has microneedling ability as well. So for some patients that want to do a little bit more of an aesthetic forward treatment, so it's customizable and we can do a lot more with it.
Yes, it's so good to just hear it from a doctor like yourself. What should our takeaways be today with dry eye, and I know scheduling those eye exams?
When patients come to our office, we do gland images on every single patient. We'll look at those meibomian glands. So early detection is key. If you do have some symptoms like itchy eyes and dry and gritty, don't just use artificial tears.
Okay.
Those are just masking the symptoms. See your eye care provider. We have solutions now. We have actual solutions that work and they can be symptom-free.
Well, thank you so much for breaking all this down for us today. We really appreciate it. Learning about dry eye, it's comprehensive, but it doesn't need to be difficult. We just need to schedule our eye exams and get on the treatment path.
Absolutely. Thank you so much for being here. This is an important message and campaign for all of our everyone's suffering from dry eye.
This July, be sure to schedule your eye exam. For more information and to sign up for an exam, visit oregon.aoa.org and visit southwaterfronteyecare.com to learn more about South Waterfront Eye Care right here in Portland.
That segment was sponsored by the Oregon Optometric Physicians Association, MACU Health and Vision, and the Healthcare Alliance for Patient Safety. We look forward to learning more about dry eye all month long, and don't forget to schedule that annual eye exam.